Secondary hyperparathyroidism due to chronic renal failure is one of the serious complications in patients with end-stage renal disease. Factors that may contribute to secondary hyperparathyroidism include hypocalcemia, phosphate retention, vitamin D deficiency, reduced vitamin D and calcium sensing receptors. All will lead to diffuse and polyclonal cell proliferation. In some of them, it will progress to nodular growth within the diffuse hyperplastic tissues with presence of autonomous and dual-phase technetium 99M MEB scanning has proven particularly useful in preoperative gland detection in patients with primary and secondary hyperparathyroidism, passive diffusion, active transport of the MEB associated with mitochondrial sequestration that is increased in the presence of adenomas will eventually lead to a slower wash out of the MEB and accumulation within the hyperfunctioning parathyroid. We aimed at this study to evaluate the role of dual-phase technetium 99M MEB scanning as a screening test in assessing the functional status of the parathyroid gland in uremic patients with persistent hyperparathyroidism that cannot be controlled medically to select those who in need for parathyroidectomy. 30 patients were included in this study, 13 women, 17 men, chronic renal failure, persistent secondary hyperparathyroidism. All patients were on chronic regular hemodialysis for variable durations. The majority of the patients presented with variable frequency and severity of symptoms and complications. They all were on regular treatment, which was not interrupted during the course of the study. The mean calcium levels obtained was low normal, 8.7 plus or minus 1. Phosphorus was high. Creatinine and parathormone levels were also high. Technetium 99M MEB scintigraphy was done by injecting 15 millicuries of 99M, technetium 99M MEB intravenously with early images of the neck and upper chest taken in 20 minutes. Again, delayed images of the neck and upper chest were taken at 2 hours. With a low energy, high resolution parallel hole collimators, 20% window at 140 kilo electron volts with 128 times 128 matrix, zoom 2.65. The results obtained, patients were classified into two main groups with the MEB positive and MEB negative scanning. When comparing the both groups, the duration of the dialysis, the level of the serum calcium, the parathormone levels were high, significantly high. Of the 17 MEB positive scans, 23 sites were found with 3 adenomas, 12 nodular hyperplasia, and 4 diffuse hyperplasia. 13 patients only they underwent. Non-significant correlation was found on correlating serum parathormone with serum calcium and phosphorus concentrations, as well as with duration of dialysis in both MEB positive and MEB negative scan patients. However, it should be noted that patients with positive MEB scan had higher serum parathormone concentrations in the presence of higher calcium levels. This was a female patient with persistent hyperparathyroidism with a parathormone 2000 picogram per milliliter. With the MEB scan, right lower parathyroid adenoma, and by technetium 99 MDP bone scan, metabolic scan pattern is found with a complicated pseudofracture. Figure 2, in this patient there were bilateral lower parathyroid glands, mostly high. We concluded that the dual-phase MEB scintigraphy has the ability to localize hyperfunctioning parathyroid glands in a significant number of uremic patients with persistent secondary hyperparathyroidism that cannot be controlled medically, to select those who in need for parathyroidectomy. In addition to biochemical data, technetium-99M parathyroid scan can be a useful screening method to assess the functional status of the parathyroid gland in uremic patients with secondary hyperparathyroidism and to detect the functional autonomy, which is the hyperparathyroidism.